Okay, good afternoon, good morning, everyone. My name is Stephen Roach. Excited to welcome you to another one of our virtual research showcase series brought to you by the Dairy Farmers of Canada and a whole host of research partners across Canada. Today, we're excited to bring you a rather broad and deep dive into the research that's been conducted by Dr. Herman Barkema and a number of research partners and students and farmers and everyone in between that's been involved. Um, just a couple of quick housekeeping comments from me before we get going. First and foremost, this, as with all of our webinar series, are going to be offered in both languages. If you are interested in listening to our talks today in French, please just navigate with your cursor down towards the bottom of your screen and choose the globe icon, which is interpretation. From there, you can choose whether you would like the English or the French channel. If you're listening to me loud and clear and are happy with hearing it in English, stick where you are. If you'd like to listen in French, please just click the French button and you will be passed on to our interpreter, Guillaume, who will walk you through the presentations in French. Outside of that, I just want to also call out that this is a typical Zoom room. Hopefully by now everyone's comfortable and familiar with that. You do have the ability to turn yourself on camera or mute yourself. We'd prefer that you keep yourself muted at all times unless you are requested to come off mute just to keep the sound clear. The other comment is we really want to encourage questions. As the presentations go through, we're going to ask that you please add in any questions you might be interested in sharing with the group or having answered by the group of our researchers in the chat box. The chat will go directly to myself or my team, Carly and Julia. We will take those questions, put them in a document, and we will ask the researchers at the end to answer those questions for you. If we don't get to all of them, we will follow up with them offline and make sure we get answers circulated back out to you as well. So please know that we'll do our best to make sure we answer every question and any question that comes up. I know there's lots of great work to be shared today, and so we're excited to be able to bring some of those tailored answers to you as we move on if we don't have time today. With that, I would like to just hand things over to one of our major partners, Dairy Farmers of Canada, Amy Desilets, to come off and provide a brief welcome and thank you as well. So Amy, I'll hand it over to you.
Thank you, Steve, for this introduction. So my name is Amy Desilets, and I'm Assistant Director at Dairy Farmers of Canada. I just want to thank all of you for registering for today's webinar. As mentioned by Steve, this is the 4th edition of a new webinar series launched by DFC just a few weeks ago as part of our ongoing commitment to research communication and knowledge transfer. This webinar series aims at showcasing the exciting work that is happening in dairy research across Canada. And this initiative is possible thanks to the financial support of the DFC and its partners. And I also want to thank the research team from across the country for their collaboration on this initiative, and Acer Consulting for essentially organizing everything. So without further ado, I'll hand it back over to you, Steve. Thank you.
Great. Thanks, Amy. So we've got in terms of our agenda today, what we're going to do is we'll have Dr. Herman Barkema come in and provide a bit of an update and overview, sort of the bird's eye view of his work. And then he will be followed by a number of students presenting some of the more specific details of their work. I know for many of you, Herman needs no introduction, but I'll provide one anyway, because it's quite an exceptional career and biography we can share. Dr. Herman Barkema completed his DVM degree at Utrecht University in the Netherlands in 1988, and after that spent 2.5 years as a manager of a large dairy and beef herd in Costa Rica, and then taught bovine herd health at Utrecht University and worked as an epidemiologist for the Dutch Animal Health Service while completing his PhD. In 2001, he moved to the University of PEI and subsequently then to the University of Calgary, where he founded the University of Calgary Faculty of Veterinary Medicine's Department of Production Animal Health. Herman is currently professor in epidemiology of infectious diseases in Calgary at UCVM and is NSERC Industrial Research Chair, or IRC, in infectious diseases of dairy cattle. with a joint appointment in the Department of Community Health Services of the Cummings School of Medicine. He's also a foreign expert at China Agricultural University in Beijing. And Dr. Barkema's research program, as you're going to hear today, focuses on the prevention and control of diseases in cattle herds, including antimicrobial resistance. He's published more than 400 scientific manuscripts and book chapters and has lectured all over the world. He leads, as many of you are excited to hear about today, the Antimicrobial Resistance One Health Consortium, One Health at Calgary, and the Environment Research Theme in the Canadian Mastitis Network at the University of Calgary Biostatistics Center, and the Alberta Johne's Disease Initiative, just to name a few. Dr. Barkema is a fellow of the Canadian Academy of Health Sciences and was recently awarded the Plowright Prize by the Royal College of Veterinary Surgeons for his research on infectious diseases and antimicrobial resistance. So with that, Herman, please take it away.
Thank you very much, Steve. Thank you for inviting us from the group here in Calgary. And yeah, it's always a pleasure to present to dairy farmers and people consulting with dairy farmers in Canada. So next slide, please, Julia. So our partners, as you can see in the NSERC Industrial Research Chair, are actually all regional dairy associations in Western Canada, Dairy Farmers of Canada, of course, NSERC, WestGen Endowment Fund, Lactanet, and then we also work with Merck Animal Health on communication from veterinarians to farmers. So the overall scope of the Industrial Research Chair that I'm leading is that we tackle infectious disease-related problems for the dairy industry and work with the farmers, for the farmers, on potential solutions for these problems. All the time, new problems come our way. And I think it's very important that we keep our eyes open, that we look for good solutions for that, so that also your children will be able to farm in the future. The things that come our way are not minor. Think of Salmonella Dublin that is coming in from the south and that we see all over, which is another zoonotic disease. And antimicrobial resistance is something that the public also is very aware of, and we need to see how we can best tackle that. So the research in this term of the Industrial Research Chair, and this is our second 5-year term, is on Johne's disease, mastitis, antimicrobial resistance, communication between the veterinarian and the farmer, and on outdoor access of dairy cattle. So those are the main topics that we're tackling here. But so like with Johne's disease, we think actually that with all the research that we have done in the last 20 years, that we will be able to eradicate this disease from a dairy farm, which is not easy. It is a very, very difficult disease to tackle, but we are running at this moment a trial where we try to eradicate the disease on 8 farms here in Alberta. So with frequent sampling and advice on management. And like with all the research that I do, we have matching funding from other organizations, and in this case, the CAP and the ARDAR organization here in Alberta. So on mastitis, we work on genetics. I'm not a geneticist, but so I sought for looked for the best people to work on that. And those are Flavio Schenkel and Filippo Miglior from the University of Guelph. So, and we have had a great grad student, Saranya Narayana, who will defend this winter and is currently already employed by Lactanet. We worked on improved detection of mastitis in automated milking systems. We have provinces now where more than 1/3 of the herds use robots. So Ali Nakfi worked on that. And of course, some other people know a lot more about robots than I do, so that Trevor de Vries of Guelph and Greg Penner of the University of Saskatchewan were involved in that. So we work on streptococci in mastitis. And why does the one streptococcus cause disease and the other not? And why is what's the level of antimicrobial resistance? And we have a graduate student on that, Ben Keddy, who's the son of a dairy farmer from Ontario. Then we work on mycoplasma. We see it with the larger herd size that we're getting in Canada more and more. And there we work with Paul Morley from Texas A&M and also with the Dutch Animal Health Center service in the Netherlands. So antimicrobial resistance has become a big topic. We are piggybacking on a study on 150 farms that's run by the Public Health Agency of Canada and also led by the University of Prince Edward Island. And we have 4 graduate students that and two of them already graduated. So Kaylee is still in the program and Ellen as well. And then Jen Ida, who will present today, is at Cornell University now as a vet student. Diego Nobrega actually is coming back as a Canada Research Chair to the University of Calgary after spending 2 years at the University of Guelph with Dave Kelton. And the last grad student is Julia Bodenese, who is a master student and also looking at antimicrobial use. So we have all kinds of projects that we do in that. And also it's all to find out how can we best prepare dairy farmers in Canada for the pressure that will without a doubt lead to us having to use less antibiotics. And we just submitted a large proposal for the Dairy Cluster 4 project, and Dairy Cluster 4, that's Dairy Farmers of Canada, Agriculture and Agri-Food Canada, together on antimicrobial stewardship. And that's also a national project where we work with PEI, Montreal, Guelph, Saskatchewan, and also with Agriculture and Agri-Food Canada. And that shows really we work together in Canada as researchers. And that's so important because we have all kinds of different expertise, but we love to work together. Next one. So the project that we won't show today, but that's veterinary and farmer communication. We think that there's quite some more focus on how a veterinarian can better consult with a dairy farmer. So we have tried to train dairy veterinarians on how to do that, and we looked at the effect of that. So the results come in the near future. Then Anna-Marika and Berina actually will present today on outdoor access. It's another thing that comes our way, and we first wanted to see, okay, how many farms do provide outdoor access, to what groups of animals, and then how do they do it? And what are reasons that they cannot do it? And then see what we can do there, because the pressure is mounting on it, and if we want to do it, then we better do it in a way that fits the dairy farmers, and which is not always easy, as you will learn from the presentations, because of the climate that we have in Canada. It's way easier to do it in country with a more moderate climate. Next one. And then we do a lot of other projects with other countries in the world. Like with antimicrobial resistance, bugs don't stop at borders. So it's really important that if we work on bacteria and on resistance of bacteria, that we work together all over the world, and that we help countries like China, India, and other countries in Africa to really manage their livestock, so that the animals don't get sick and that we don't need this umbrella of antimicrobials to treat them all the time, and so that we then get less antimicrobial resistance that occurs. So then Wasim will present on the cattle health surveillance project that we are currently doing in Alberta, but that we hope to do with other provinces in Canada, where we monitor infectious disease and look how we can best prevent them. Then Anne-Marieke has done an effect of a breakfast on the dairy farm, where something we love, getting the public over, but to show the dairy farms, because we have nothing to hide, we're proud of what we do, but what effect does that have, and how can we best do that? And then, of course, being a prof also in the Faculty of Medicine, I got sucked in a lot of COVID-19 projects. Next one. Okay, so I think, Steve, you're going to introduce Kaylee and Ellen, huh?
That's great. Thanks, Herman. We're going to bring in Julia, my other team member, and Julia is going to briefly introduce Kaylee, and we'll get the next presentation going.
Thanks, Steve. Thanks, Herman. So next we have Dr. Kaylee McCubbin, who received her Doctor of Veterinary Medicine degree from the Atlantic Veterinary College in PEI in 2017. After graduating, Dr. McCubbin began her Master's of One Health Infectious Diseases at the Royal Veterinary College and the London School of Hygiene and Tropical Medicine in London, England, with antimicrobial use and resistance fieldwork taking place in rural Uganda. Currently, she's a PhD candidate at the University of Calgary in the Production Animal Health Department, focusing on antimicrobial resistance in the dairy sector from a One Health approach. And this includes the perceptions of antimicrobial stewardship across various professions. So I'll pass it over to Kaylee.
Thank you for the introduction. So today I'm going to speak to you about adopting selective dry cow therapy in Canadian dairy herds. I will be summarizing the findings from an invited review we conducted for the Journal of Dairy Science, with a focus on available information, but also on the practical implementation component. Next slide, please. Thank you. So antimicrobial resistance, or bacterial resistance to antibiotics in major pathogenic bacteria affecting dairy cows in North America, is relatively low at the moment. However, a major concern is selective pressure imposed by continued antibiotic use in dairy cows, which could result in emergence and maintenance of resistant bacteria. Increased prevalence of bacterial resistance in dairy cows would negatively impact animal health and welfare, but also dairy farm profitability and sustainability. As resistance to antibiotics is a major public health concern, antimicrobial or antibiotic use reductions in livestock have been considered an important area of focus. And as dry cow therapy accounts for a large portion of antimicrobial or antibiotic use on dairy farms, this is an area where antibiotic use reductions could be substantial. So one way to reduce antibiotic use is through implementation of selective dry cow therapy, where the goal of selective dry cow therapy is to identify only those cows who would benefit from antibiotics at drying off, where treatment decisions could also be done at the quarter level, but only if the information you have available allows for that. But I'll get into that a little bit further. As for impacts, there is general agreement in the literature that antibiotic administration has benefits, specifically resulting in improved bacteriological cure rates over the dry period compared to no antibiotic use. Therefore, understanding selective dry cow therapy health impacts are more so focused on highlighting the differences in healthy animals receiving preventative antibiotic use and those who do not, and whether enacted selection criteria can appropriately identify udder infections or intramammary infections or those high-risk cows. Primarily evaluated health parameters are intramammary infections and somatic cell count dynamics in the subsequent lactation. However, the good news is that recent literature is very positive regarding selective dry cow therapy, and it shows that with careful consideration of selection criteria and overall dry cow management, selectively treated cows do not appear to be at a disadvantage or suffer any significant health impacts. As milk production can be negatively impacted when intramammary infections are present at calving, Unintended increases in somatic cell counts or mastitis incidence through selective dry cow therapy could adversely impact milk production and, of course, subsequently farm productivity and profitability. And, oh, sorry, can you go back? Thank you. And so unintended somatic cell count and mastitis incidence increases could occur, for example, if there were unidentified infections present at calving that were at drying off that were not addressed, or if they developed during the dry period without sort of the preventative component of the antibiotic use. However, this does not appear to be the case, and it is possible to enact selective dry cow therapy without having a subsequent impact on animal health in the ways that I've described. And there are some recent examples that specifically look at milk production in their comparisons of blanket and selective dry cow therapy that have shown no negative production impacts. However, the majority of these studies do include the use of teat sealants in their selective protocol, which brings me to my next point. Thank you. There are other, of course, additional considerations for drying off of dairy cows, and the first being the use of teat sealant. So teat sealants have been shown to be as effective as antibiotic use when used in low-risk cows in selective dry cow therapy protocols, where actually recent meta-analysis suggests that selective dry cow therapy protocol success depends on the administration of teat sealant, at least to those cows who are not receiving antibiotics at drying off. And other management factors are, of course, very important for overall dry cow well-being and limiting udder infection risks, which can include milk production levels at dry off, so abrupt cessation versus gradual milk reduction, overall nutrition, housing, culling of chronically infected cows, among other things. And of course, as these things are also very important, however, their in-depth discussion lies outside the scope of the presentation today. And next slide, thank you. So before we get into details of protocol, it should be noted that not all herds should necessarily implement selective dry cow therapy at this time. There may be other important areas to focus on first to help ensure success of selective dry cow therapy once your herd is actually ready for it. Some of these considerations include good record keeping, access to frequent somatic cell count reporting, or availability of culture results if you choose to use a bacteriological culture method. And finally, the willingness to invest in required equipment or trained staff. So you need to both be able to actually implement your chosen protocol and have the ability to see any health or production impacts that may follow. There are a number of protocols that have been shown to be successful, including both bacteriological culture, so milk culture results, and somatic cell count threshold-based methods. As one example, I will be just quickly summarizing the protocol currently supported by Lactanet. As described, so not all herds should necessarily implement selective dry cow therapy on their herds at this time. In this protocol, it is specifically recommended that herds could consider selective dry cow therapy if they have a minimum of 8 somatic cell count test results, low bulk milk somatic cell count, but also I would add hygienic dry off procedures and housing. Once appropriate herds identified, cattle selection aims to identify high-risk cows that would either have an intramammary or udder infection at drying off or be likely to develop one during the dry period. Specifically, they must have somatic cell count average below 200,000 cells per milliliter on the last 3 tests, but also specifically on the last test before drying off. And the data of the test before drying off also needs to be available. To be considered, they also must have no more than 1 clinical mastitis case during lactation. And some recent literature suggests that this inclusion of clinical mastitis may not be beneficial in the overall selection protocol, but it is helpful to include and to have the records to be able to include that information as well. And so moving on to, thank you, the direct impacts on the development of bacterial resistance associated with dry cow therapy, and in particular kind of the protocols that I've just been going over. So intramammary administration of antibiotics for dry cow therapy was associated with bacterial resistance for some pathogens, but not for other. So the overall consideration is currently unknown. However, we do know that there are some impacts. And regardless of large-scale impacts, we do know that they're present, but there are broader scale impacts of antibiotic use on farms as well. Therefore, overall reduction should not be overlooked. For example, there is evidence that reducing antibiotic use on farms reduces the prevalence of resistant infection in farm workers and their families, where overall industry attempts to reduce antimicrobial use or antibiotic use on dairy farms could yield substantial benefits to producers, animal health, consumer perception, in addition to potential reductions in resistant infections. Some challenges, it is essential to consider the various drivers and barriers to selective dry cow therapy adoption in order to increase uptake. Some research has been conducted to improve understanding of producer and veterinary motivations with respect to decreasing on-farm antibiotic use. Contextual factors are very important to consider, like, for example, regulations, where some countries like the Netherlands have banned blanket dry cow therapy altogether. However, regulations like that don't currently exist in North America. However, it is clear that cow management decisions in general can be impacted by producer attitudes, behaviors, perceptions, previous experience, economic considerations, including lack of time and resources, climate considerations, biosecurity, social pressure, among other things, as well as perception of risk and difficulty with implementing a management change, where sort of concern for financial consequences of uncertainty regarding mastitis recovery without antibiotic use or potential production losses were kind of the most important factor for producers in this research choosing to do blanket dry cow therapy over selective. However, as described, these risks can be limited with proper consideration and especially inclusion of teat sealant. Next slide. Just as an example, overall in 2020, there were 31% of 144 producers participating in the Canadian Dairy Network for Antimicrobial Stewardship and Resistance. So across BC, Alberta, Ontario, Quebec, and Nova Scotia, that said that they were currently enacting selective dry cow therapy with an average antibiotic use reduction possible of 50%, which really highlights the amount of antibiotic use reductions possible with a large-scale uptake. Next slide. So overall, in summary, selective dry cow therapy is feasible and safe to enact in Canadian dairy farms with the considerations that I've sort of laid out in this presentation, especially in those herds with low udder infection rates, bulk milk somatic cell counts, and good record keeping. There are other protocols that can be enacted just beside the one that I've described or adapted to fit your farm. And if you are not already enacting selective dry cow therapy, I would encourage you to discuss it with your veterinarian. Thank you.
Thanks, Kaylee. Next, we have Ana Marique and Barina. So Ana Marique obtained her bachelor and master's in animal science at Wageningen University in the Netherlands. She then pursued a PhD at the Animal Welfare Program at the University of British Columbia. In her PhD, she investigated the preferences of dairy cows for different types of outdoor access. And after completing her PhD in 2019, she moved to Calgary and started a postdoc position with Herman Barkema. Barina obtained her bachelor in animal biosciences at the University of Saskatchewan in 2017, and she's currently a master's student with Herman, working on understanding how different types of outdoor access will affect dairy cattle health. So I'll hand it over to the both of them to present their information on outdoor access for dairy cows.
Thank you, Julia. Hello, everyone. Thank you for being here. Yeah, we will talk to you about the studies that we've been conducting on outdoor access for dairy cows. So the first thing is, why did we even bother, right? So we know that dairy cows have a partial preference to access pasture or alternative outdoor areas such as a dry lot. And we also know that overall, the North American public views outdoor access for dairy cows as important for animal welfare. That said, when we look at the percentage of farms that in Canada that provide access to pasture, we see that it's different, as you can see in this graph, by province in terms of the percentage of farms that provide lactating cows with pasture access. overall, it is 30% of the farms in Canada provide the lactating cows with pasture access, and then a total 60% of the farms in Canada, dairy farms in Canada, provide dry cows with pasture access. And especially for the lactating cow part, you can see that that is maybe somewhat in contrast to what we found in terms of public perception and dairy cow preference for these for outdoor access, which show that that may be important for these stakeholders. Interestingly, though, although we know that for cows it's important, at least in certain weather types, to have outdoor access. For the public, it seems to be important. We didn't really see anything that was that was in the literature on the perspectives of the dairy farmers on outdoor access. And you would say, I mean, ultimately, of course, the dairy farmers, they are the ultimate decision makers on whether these cows get outdoor access or not. So we wanted to basically understand this graph a little better. So what we did, Julia, one more slide. So the aim was to understand the dairy farmer views on outdoor access for dairy cows. And we did that, and maybe some of you on this call have filled out that questionnaire. It was an online questionnaire, Canada-wide, sent out to dairy farmers, in which we tried to understand the current outdoor access practices. So not only pasture, but also alternative outdoor areas, but also everyone at least that filled out the questionnaire, the perspectives on that. So if you provide outdoor access, why do you do that? And if you don't, why do you keep the cows in the barn? So we wanted to get a better understanding of this, of this topic on the perspectives of the farmers on this topic. So what we found was interesting, because we found several on-farm, but also several off-farm teams that influenced dairy farmers' decision to provide outdoor access to their cows or not. So outdoor access, again, is not only pasture, but it's also a dry lot or anything that is alternative to pasture, but is still outdoors. So interesting what we found a few on-farm teams, but also a few off-farm teams that Marina will talk about, that influence dairy farmers' decisions to provide outdoor access or not. And you can see the 6 on-farm themes depicted here. Most of them, I think, speak for themselves, but it's interesting to know that all of these 6 provide, are themes that are given by farmers that provide outdoor access, as well as as by farmers that do not provide outdoor access. So, for example, in terms of cow welfare was, for some people, it was a reason to provide cows with outdoor access because they thought it would be beneficial for the cow welfare. For other people, it was a reason to keep the cows in the barn because they were convinced that cows have a better welfare in the barn. In terms of climate, I guess that kind of speaks for itself, but some people struggled with having the cows outdoors in terms of the weather or the climate conditions. So or too wet or too warm, etc. And other people said, well, actually, I'm living in an environment in which I can provide outdoor access. Interestingly, that was sometimes even in the same province. So you could see that sometimes it was perceived by a barrier, whereas for other people, it was not. In terms of economics, especially that related to the lactating cows on pasture, lots of people were hesitant to provide lactating cows access to pasture because they were fearful of decreases in butterfat and milk production. Whereas other people, especially organic producers, said, well, actually the increase in the milk price that I obtain for my milk because I pasture my cows is interesting and it's good for the profitability of my farm. In terms of the environment, some people said, well, I think it is dairy farms are more environmentally friendly if they keep the cows indoors. And some people said the opposite. And then the last 2, I think, really speak for themselves. Infrastructure was a big theme, because it was very important for people to have easy outdoor access. If you provide outdoor access, then it needs to be easy. So that was a big determinant. And in terms of management was also very interesting. Everyone wants ease of management, but what that meant was different for different people. So some people said it's much easier for me to keep my cows in a freestyle barn, for example, because I can control everything better, the diet, the climate for the cows, everything. Whereas some other people said, well, no, I think it is much easier to manage my cows when they have outdoor access. So these were the on-farm teams, and now Brina will go over the off-farm teams that we found.
Yes, thank you. So yeah, I will now, excuse me, go through the three main off-farm themes that participants and farmers had mentioned in this study as a reason to provide outdoor access or not to provide outdoor access, as Anne-Marika had mentioned. So these off-farm themes being external factors that are affecting the farmers' perceptions and their decisions on whether or not to provide. These three themes that we found were the general public, the dairy industry, and dairy research. So first I'll go over the general public. Some farmers had said that there was a barrier for them in terms of the general public not being willing to pay more for premium products produced by dairy cows that were provided pasture access. At the same time, some used that motivation as a reason to provide outdoor access to their dairy cows. Marketing of dairy products with pictures of dairy cows on pasture on the products was seen as a reason that the public are motivated to see cows on pasture. And although it was considered effective marketing, participants agreed that it was not generally reflective of the reality, and they shared concerns that it would create unrealistic expectations for the general public. In terms of the dairy industry, participants outlined that the Canadian dairy industry supply management system requires a consistent flow of production, which is believed by farmers to be better obtained with an indoor environment for their cows. As well as a loss of milk fat in the summer was perceived as a concern for farmers with keeping up with the daily quota that Canada requires from their dairy farmers. Some participants in our study also believe that pasture or outdoor access, at least for part of the herd, may become mandatory through the Dairy Farmers of Canada Pro-Action Initiative. However, it was also mentioned that because of the Pro-Action Initiative, cow welfare and the indoor environment is already being well addressed. When talking about mandatory requirements for pasturing or outdoor access came up in this study, some farmers mentioned that if science would show that pasture or outdoor access alternatives showed benefit for dairy cows, especially in health and production, that the dairy industry and the farmers themselves might be more willing to incorporate this type of management system for their cows. Which leads me to the third off-farm theme that we found, which is research. It was suggested that more research be done in understanding how the benefits of outdoor access can be incorporated into outdoor systems and indoor systems. It was also suggested that farmers should be more involved in the research process to ensure that their input was taken into account by the researchers. This was really exciting for us to hear from farmers about the fact that they are very interested in more research in this area. Could you go to the next slide? Which led us to our new study. So following the findings from our research, we've designed a new study that aims to understand how the difference between different types of outdoor access affect the cow health, specifically mastitis incidence, hoof health, and transition disease. From our communication with farmers, we know profitability factors are important as well. So we've incorporated a profitability component to this study as well. It is a large study, including 140 farms in Alberta and BC. We are still recruiting farmers to participate. Unfortunately, we are unable to include tie stalls. However, all freestall farms, regardless of if you provide outdoor access or not, are eligible to participate. So we are very excited about this large study that we're doing, and we're extending the invitation to participate to all of you today. So if you are interested in participating or would like more information about our new study, please do not hesitate to reach out to Anne-Marika Smith. Her email is there at the bottom of the screen, and we can provide you with more information. Thank you so much for listening, and we're happy to take questions at the end of all the presentations.
Thank you both. Next, we have Jennifer Ida. So Jennifer received her bachelor's in anthropology from Wagner College in New York. She then went on to complete graduate work in anthropology at the University of Colorado, Boulder, and received her MA in 2016. Under the mentorship of Dr. Barkema, she then earned her Master's of Science in Production Animal Health at the University of Calgary in 2020. The focus of her work was on social aspects of antimicrobial use, resistance, and regulation in dairy farming in Alberta, Canada. She's now a Doctor of Veterinary Medicine candidate in the class of 2024 at Cornell University's College of Veterinary Medicine. So with that, Jennifer, the floor is yours.
Thank you for the introduction, Julia. Good morning or afternoon to everyone, depending on where you are. So yes, the focus of the work is on understanding dairy farmers' perspectives on antibiotic use and regulation in the dairy industry in central Alberta. Next slide, please. So in this presentation, I'll provide an overview of the health challenge, touch on the anthropological methods used in the study, and share the key findings. So as Kaylee mentioned, in the last 10 years, there's been a steep increase in pathogens resistant to antibiotics, posing a significant global health issue. And antibiotic use in animal agricultural systems, including dairy farming systems, is also of concern. Although there is an ever-growing body of literature on dairy farmers' knowledge, attitudes, and practices concerning antibiotic use, there's really not much in terms of an in-depth understanding of the context of dairy farmers' perspectives on use and prospective regulation, and that's specifically true in Alberta. So to begin to address this gap, the objective of the study was to understand the perspectives of one community of Albertan dairy farmers concerning antibiotic use and resistance within their broader context. And by doing so, we're now able to provide policymakers with context-specific information. So to carry out the research, I relocated to an agricultural town in South Central Alberta, and I was there for a total of 4 months. And while there, I conducted interviews with 25 dairy farmers in the area and engaged in the routine activities both on and off farm as a way to really understand from the topic, from the perspective of the producers. So we found that there are a number of key aspects of the context that should be considered to better understand the lived experience of the farmer in this particular dairy farming community. And so these are the supply management system, current access to antibiotics as dictated by the national, provincial, and the local bylaws, religion, family and heritage, and the built environment. However, due to time limitations right now, I'll not delve into these, instead focus on the more specific perspectives revealed through the interviews. So we found several key values expressed by dairy farmers throughout the interview process. Dairy farmers in the sample can be described as people who care. So they care about animal health and welfare, the environment, people in their community, and the safety of the product. They can also be described as autonomous actors. So this value was explicitly reflected in concerns related to antibiotic regulation. For example, one producer stated, "I hope antimicrobials will always stay available to us. You try to reduce as much as you can, as long as it's still available, so you can act when you think you need it." And this freedom provides producers with a sense of agency or the ability to act as they see fit. Many expressed frustration regarding both the general public and consumer perception of dairy farming. And so one shared, "I think some of the farmers have lost a little trust in the consumers, and the consumers maybe lost a little bit of trust in the farmers." And so concerns about the gap between the farmer and the consumer, he then stated, "We have to close the gap between consuming milk products and what we're actually doing on the farm." However, he and other producers expressed that they were not very optimistic about achieving that. And they noted the difficulty in trying to change consumer perception despite repeated efforts to cultivate a positive image for the industry. The same producer also stated that the constant public criticism created an environment in which the producer is not open to change, but rather becomes more committed to his position. So he shared, "If we get criticized long enough, you kind of get more radical with your stance, defending what you're doing instead of looking for a new approach to maybe change." Participants expressed frustration and disappointment with public perception, specifically in terms of their knowledge, education, and experience. So although generally supportive of reducing antibiotic use to protect human health, one producer shared his concern about policy that would require him to have a veterinarian treat all of his cows. And so he stated, "I think it totally takes away the experience and knowledge that the farmers already have. You're essentially being told you do not know what you're doing and you just need to conform. If that were to happen, it would be very disappointing, and I'm sure there would be a better way to do it." There were a range of views concerning the connection between antibiotic use in agriculture and antibiotic resistance in humans. However, due to diligent following of mandatory milk safety protocols, so that is the withdrawal times and the bulk tank testing for residues, some participants were unclear on how dairy farming could contribute to resistance in humans with these protective measures already in place. And so regarding changing on-farm practices that may cause resistance in humans, one farmer responded, "If I have proof that people are consuming milk and that they're getting resistance to antibiotics because of it, maybe I'll change my tune, but I do not believe that's happening." However, others were less skeptical of this connection. They were also quite frustrated by a lack of clear information regarding the pathway by which antibiotic use on dairy farms may pose a public health concern. And so one participant shared, "They act like we're shipping milk and meat with antibiotics in it." I'm kind of like, no, there's not. You're not allowed to do that. And the milk, it doesn't work because you can't make cheese, you can't make yogurt, you can't make anything. So there are no antibiotics in it. So many responded with arguments that the milk is safe, specifically that there cannot be residues in the milk. And they can attest to this because when they administer an antibiotic to a lactating cow, they must adhere to strict withdrawal times or risk very hefty penalties. And so one farmer clearly articulated that, "I think it comes down to the science of it. Like, where is the problem exactly?" Which I thought was, articulated really well. Next slide, please. We also found that perspectives on potential future regulation may be informed by producers' close connections to and familiarity with the dairy industry in Europe, particularly in the Netherlands and Switzerland. And so when discussing antibiotic use during a Saturday afternoon community gathering, one farmer stated, "We're becoming Europe." Another shared, "The thing is, they keep saying this regulation program is going to be the answer. Now we have another regulation program coming in. Is it ever going to stop? No, we are going to get to be the Netherlands shortly." These concerns were consistently expressed in interviews and informal discussions, and many were specifically concerned that Canada might adopt similar protocols to those in some European countries, such as the requirement that a veterinarian administer all treatments and that this would be expensive and reduce animal welfare. However, perceptions of farming regulations in Europe were not always straightforward. And so one producer who stated that we would like to work to prevent Canada from taking a route where a veterinarian is needed for each treatment, also shared that he decided to switch from blanket to selective dry cow therapy based on European-based literature, which outlined parameters to consider when deciding to treat. And so in his particular case, some aspects of European protocols were desirable, but in other cases too extreme. Participants in the sample also expressed concerns regarding regulation that would require prescription per animal. And so one participant whose parents farm in Holland said, "It would be nice if we don't get prescription per cow because that is how they do it in Holland now." However, the same farmer also shared that we can learn from farmers' experiences in Europe. And so in reference to switching to selective dry cow therapy, he stated, "In the beginning, there were big disasters in Holland and people said that it's never going to work. And now it seems like everybody's doing it because they have to." He added that if Holland and Europe do it now first, then we can learn from that. And if it works over there, we can implement it over here. So to summarize the findings, many dairy farmers in the sample, one, value their autonomy and hope to maintain agency regarding antibiotic use. Two, have shared cultural and immigrant identities, which may inform their perspectives of future antibiotic use and regulation. Some feel that certain antibiotic use policies implemented in other contexts would be impractical in Alberta and would constrain their freedom to make what they perceive to be the best decisions for their animals. Believe that their knowledge and experience are undervalued by consumers, are concerned that the public does not have a deep understanding of dairy farming, and so therefore worry that antibiotic use policy will be based on misguided consumer concerns rather than scientifically driven. And lastly, are variably skeptical of a link between antibiotic use in dairy cattle and resistance in humans, mostly due to their strict adherence to milk safety protocols. Next slide, please. So we hope that by shedding light on these perceptions and the lived experiences and values of the farmers, we're better positioned to help policymakers develop antibiotic use policies that best fit the needs and preferences of the dairy farming community, specifically in Alberta. And we expect that the concerns and voices of the farmers, which have been provided in the results of the study, are reflected in future policy. Thank you.
Thank you very much, Jen. I'll now introduce our last speaker, Dr. Wasim Shakot. So Wasim is a veterinarian from Pakistan and has over a decade of experience in the dairy sector. He obtained his Doctor of Veterinary Medicine from the University of Veterinary and Animal Sciences in Pakistan in 2009 and a master's in epidemiology in 2020. He started his professional career through a dairy development project called Dairy Hub at Tetra Pak Pakistan Limited and later joined Solvay AgriPak Limited, where he worked as a dairy development and capacity building manager until 2015, and then as a general manager from 2016 to 2021. Wasim also held the role of General Secretary for the Corporate Dairy Farmers Association of Pakistan from 2014 to 2021. He's currently pursuing his PhD at the University of Calgary under the supervision of Dr. Herman Barkema, and he's focusing on epidemiology and economics of infectious disease control in dairy cattle.
All right. Thank you very much, Julia. It is a great pleasure to be able to talking to the dairy farmers once again, something that I have always enjoyed over the last decade. Depending upon your location, ladies and gentlemen, I would like to say a good morning or a good afternoon. Today, I'm going to talk about infectious disease control in the dairy farms. Next slide, please. As a dairy farmer, we all know that we are often having challenges of several types of infectious diseases. And we as researchers sometimes focus on one disease and sometimes on another disease. But thanks to our collaborators and Dr. Herman Barkema and our donors that we have come up together a more comprehensive approach called Cattle Health Surveillance System Project. This project offers a comprehensive approach to monitor and control multiple infectious diseases at a single point in time. Today in this presentation, I'll talk about our approach for this project, and then I will also share some of the preliminary results that we have so far. Next, please. Okay, so let's talk about what the CHESS program has to offer with this approach. As I mentioned earlier, that we're talking about multiple endemic infectious diseases. That means the diseases that we have always been there, and some of the diseases that we have like kind of agreed upon to live with. But despite that, we still want to control them. We still want to reduce their burden, mostly in order to improve animal welfare, animal health, improve the product quality, as well as improve the farm profitability. And the major disease of importance for this project is contagious mastitis. Apparently, it's a one disease, but it is not. It is caused by several types of different infections, and each have a different strategy. So in this project, we're talking about contagious mastitis, and we'll focus three of its main infections called Staphylococcus, Streptococcus, and Mycoplasmas. Apart from mastitis, we will be in this project looking into leptospirosis, neosporosis, leukosis, Jaundice disease, and Salmonella Dublin. With these diseases, what we are really, this project is offering us is up-to-date disease burden estimates. We all know that until or unless we measure something, we cannot improve. If we really don't know where we are standing today, we really have no clue where we are heading tomorrow. So this is important that this project offers us up-to-date estimation of the disease burden across Western Canada, particularly in Alberta, where we have already rolled this program. Then we'll come up with comprehensive disease control strategies, which are customized and tailored to the individual farms that we are working with. We're not talking about the generic control strategies, because often we see that generic control strategies doesn't work at every farm. The third and main component of this project is adaptation of biosecurity measures. We all know and we agree that these diseases have a lot to do with biosecurity practices. And the biosecurity is important in order to mitigate the risk of these diseases, the spread of these diseases. But often we see that biosecurity practices on table or on paper looks very nice, but no strategy is perfect until or unless it is implemented. So we have often seen that not every farm is implementing the same strategies. So we have to really dig into the reasons why it is happening, and we'll explain later in my presentation. So this is an important component as well. Then the project will come up with practical sporting tools that will help you, the dairy farmers, make appropriate decisions to control these diseases. Next, please. Okay, so as a project, we have three main aims, as mentioned and explained earlier: a surveillance program that offers about the herd level, and then within herd level, a measurement of the disease burden. We in epidemiological language say there's prevalence, but I would preferably use the word burden. And it focuses on the development and implementing the control measures on some of the selected dairy farms that will act as a demo farms for the other farmers to follow. And most important component for this project that we have devised is economic impact of these diseases. We'll estimate the economic impact of diseases, and we'll also have economic evaluation for the disease control strategies. Because if a disease control strategy is not economically effective or viable, no farmer is going to implement that. The second main aim of the project is biosecurity measures that we will have a lot of emphasis on. And the third one is improving the antimicrobial stewardship, particularly with regards to selective dry cow therapy and selective treatment of clinical mastitis. Next, please. Okay, so coming to the surveillance program, as I mentioned earlier, we have like two steps methods in here. First, starting with the herd level burden of disease that we are measuring through bulk tank milk sample testing from all the dairy farms in Alberta at the moment. They will be subjected to ELISAs and PCRs, with the exception of Johnny's disease, for which we will be taking environmental samples for the testing. Once we have this, the next step is to go into within herd prevalence for 4 infections, neosporosis, and 3 of the contagious mastitis. Next, please. I will just now present you preliminary results from our first testing that are available at the moment for your information. Next, please. Okay, the approach for this testing is, as mentioned, we have like close to 500 dairy farms here in Alberta, and we collected bulk tank milk samples with collaboration with Alberta Milk, thanks to Alberta Milk team, 4 times during the last 1 year, December last year, then April, July, and October this year. The bulk tank milk samples from all the dairy farms. And then we, in our lab, we tested through ELISAs, and we continue testing through PCRs, as some of the tests will go through PCR as well. So the results of the ELISAs were then either positive or negative. For ELISAs, we are detecting antibodies in the milk against several infections. Next, please. Okay, so the results that we have for example, for leukosis, you can see that from all the 3 different testings we have, we're still testing for the recent collections at the moment, and we will have the results later on. But from the last 3 collections, we see that nearly 90% farms are positive for bovine leukosis. This is a viral infection, and it's really highly prevalent in Alberta. And I assume that it's also in other provinces as well. Next, please. And the second results that we have available today is neosporosis. For our first time point collection, we saw that about 18% farms were positive. However, the subsequent testing showed us that around 7.5% farms were positive. At the moment, we are testing for the last time, and we will get to know whether they align with the last 2 testings or there is a difference. We are also retesting the first December 2021 samples, the positive samples, to reconfirm whether they align with the subsequent collections, or there were some other reasons that we're trying to identify. Next, please. As we go forward in the coming few weeks, we will have more results from these testings for the last collection as well. Additionally, we will have results from our Salmonella Dublin testing, as Herman mentioned in his presentation, that we expect that might be some of the farms will result positive as well. Leptospirosis results will come up, and then through PCR we'll come up with the results from contagious mastitis pathogens. Next, please. Okay, going forward, as I explained to you about the herd level disease burden, and once that is done, we are then going for the selected farms and selected diseases for within herd prevalence. And then we'll implement the control programs. Next one. For the control programs, we are going for developing and implementation farm-specific disease control strategies with an economic impact analysis. And most importantly, we really want to dig into understanding what are the drivers and the barriers for the farmers that helps them adopt or not adopt certain biosecurity practices, because then we can come up with a solution. So, and then we'll provide the feedback to the farmers who are closely working with us. Next. So that is all. We are working with the farmers. We are working for the farmers. Thank you very much.
Thank you. And I'd just like to acknowledge all the funders and supporters of this research today. So all these funders listed here have been great supporters in funding and supporting the research by Dr. Herman Barkema as well as his team. We are just at the end of our timing here. So for anyone who has submitted questions in the chat, we will be reaching out by email to address your questions. We'll also have a follow-up email to everybody who attended today with a recording of this presentation and some notes about questions that we did receive. I also just wanted to quickly point to our upcoming webinar, which will be held on December 14th at 1:00 p.m. Eastern. And so this next webinar will feature the Mastitis Network, including Dr. Simone Dufour, Dr. Trevor DeVries, and Dr. Jennifer Ronholm as our next presenters. So please register to attend. The email for that will be coming out shortly, and we're looking forward to seeing you all there. So thanks again to Dr. Herman Barkema and his team. It was a pleasure to have you all here today. And thank you to everybody who joined and participated.
And just before you leave, I'm just going to see if Herman wants to add any final remarks here just to the group.
The only thing I want to say is doing all these seminars shows what a great community we have in Canada to work together on addressing those issues that we're dealing with. And what we're doing in research is not only important for research, but also educating great young people that thereafter will be very important for our industry. Steve Roche is actually a prime example of that, but Laura Solano, Diego Nobrega, who comes back here. There are many examples of the people that we in Calgary educate at our universities and then become important for our industry. So I would like to thank you all for giving me the opportunity to work with you all in Canada. It has been a pleasure for the last 21 years that I'm here, actually.
Wonderful. Thanks, Herman. And thanks, everyone. Have a great afternoon, and we'll look forward to seeing you again soon in our next virtual research showcase. Have a great day.